Are you feeling anxious about starting a GLP or like Ozempic or Zepbound, or are kind of frozen in decision making? You are so not alone. This is a topic that comes up over and over again in my therapy sessions. And one of the things that I'm realizing is that that is because there is like a collision of hope and fear. Hope, I might finally get the success or the outcome that I've been looking for, which is help managing my eating and my weight, mixed with fear. Because I always say, literally, the second people start to lose weight, they experience anxiety, not about the weight loss per se, but about the prediction that we make that we are going to regain weight. Because for people that have been on this journey for so long, there is just this inherent notion that I'm going to lose some weight for some time and then it's all going to come back plus more. And quite honestly, if we look at the data, we understand why people have that fear. But so I think one of the things that prescribing physicians don't really understand when they're talking to their patients is that it is a really complicated thing to consider losing weight on a medication, because we're so worried. What if this medication stops working for me? What if my body doesn't respond to it appropriately? What if I do lose the weight and then I can't afford it anymore? Or what if I lose the weight and then it stops being effective and my weight comes back? I am hearing all of this anxiety about medication use in my office. And so I just do a lot of grounding work with people and remind them of a couple things. Number one, fear of weight gain is actually not a predictor of weight gain, right? It is a predictor of having anxiety, because we know that based on past experiences, that's a pretty normal thing to fear. But just because you fear it doesn't mean it's going to come true. Number two, these medications are meant for mostly long-term treatment. And we have some pretty good data that when people stay on therapy, that their weight tends to stay in the zone where it's going to get, depending on their responsiveness. And then lastly, we are kind of at the tip of the iceberg in terms of obesity medications and weight medications. So often I tell patients, look, is it true that you will be on this exact medication forever? Probably not. And that doesn't mean because you'll discontinue meds, but it just means because there are so many things coming in the next 5 years or 10 years that there's probably going to be something that we will switch to or try in the future. And it may change mechanism. It may change how you dose, like injection versus pill and other things. And there's just so much new information and data coming at like, it's like drinking from a fire hose, honestly. So I try to remind clients that, and sometimes that helps because for so long we have felt trapped by such limited options, and people, we are not there anymore. I hope this is helpful.